Staying with us now, the Deputy Minister of Higher Education, Science and Innovation, Buti Manamela, together with the Higher Health MEC, Dr. Ramathuba, will host a GBV Dialogue in Polokwane today in an effort, or rather, Dr. Popi Ramathuba will hold a GBV Dialogue in Polokwane today in an effort to address the scourge of gender-based violence. For more on the story, let's cross live now to our colleague Katlego Nyoni in Polokwane. Katlego, you at the Capricorn TVET College this morning. What's happening there?
That's right, Desiree. Good morning, and to our viewers as well. Yes, indeed, you are quite correct. The Deputy Minister for Higher Education, Science and Innovation, Buti Manamela, joined by the MEC for Health in the province, Popi Ramathuba, are today going to interact mostly with female learners who continue to experience a myriad of challenges that may perpetuate issues around gender-based violence, issues such as alcohol and substance abuse. But to get more clarity on the specific GBV dialogue, we know it is still Women's Month. We're going to find out first from the MEC for Health in the province, Dr. Ramathuba. MEC, a very good morning. We are still celebrating and observing Women's Month. What is this program hoping to achieve, particularly looking at the university sector?
Morning, Kat, and morning to all your viewers out there. I think what we really need to appreciate is the partnership between the Department of Health, especially our province, and also Higher Health. And that is why you see us here jointly together. The relationship is not starting today with the First Thing First program that as a province we've been able to equip all our TVET colleges with 16 clinics that we support, and also our 2 universities also have got their own clinics, and in those clinics the students are able to get all these services, not just for HIV treatment, not just for minor ailments, but equally to deal with the scourge of gender-based violence. So that is why today we are hoping that as part of this Women's Month observation and celebration, if we really need to fight and win the scourge of gender-based violence, the empowerment must start at the younger age. When you look at the statistic, especially of this campus, out of those 30 reported cases, only 1 is a case of a sexual or rape within probably the campus, but the remaining 29 are relationship related. That is why we need to empower a girl child to understand about her rights in the relationship. And from us, from a medical point of view, I always say a girl child must probably be trained not to do what we used to do in the past. Before you fall in love, you look at the size of a pocket. This time around, before you fell in love, do mental state examination. Because if you do that, you'll be able to understand that the monster that you are falling in love with, it's not necessarily going to be your partner. And we want to teach the girl child from a young age that they need to identify abuse from that young, because people think that when you are given a slap, it's love. When you were seen with cat and the partner gets jealous, it's love. It starts like that. So we think the dialogue will go a long way in empowering the girl child, educating the girl child, informing the girl child, and also the boy child, by the way, what needs to be done, what in a relationship, to say a woman or a girl, what she needs, it's love, it's care. It's all that. You also, the boy, must understand that this girl, it's your sister. This girl can be your mother, can be your aunt, can be your grandmother. So if we do it at this younger age, I believe as a country we will win it. And most importantly, in our dialogue, you'll see that there's also issues of mental health, which will go deeper into that, so that we can be able to pick up, because some of the GBV's cases that you continuously report about, for instance, if a man wake up in the morning, shoot all the children, kill the wife and kill himself, you can't reduce it to just GBV. You've got to deal with issues of mental health, and signs and symptoms will be there. We want to teach these young students to understand that how do you pick up those signs early and seek help early.
Thank you very much. That's the MEC for Health in the Limpopo province, Dr. Ramathuba, I'm just going to bring in the Deputy Minister here to just get a few of his responses. Deputy Minister, we know that young females, particularly in our country, are faced with issues of, societal economic challenges that may stagnate their growth, towards empowering themselves as women. Just very briefly for me, Deputy Minister, how are you hoping as government to, address some of these issues that are facing young women in our country?
Well, look, I think the first thing is that we believe strongly in the power of conversations. What we've seen over the last few years that we've been having this first things in engagements and also this gender-based violence and femicide engagements is that we've seen young men and women coming out and talking about their fears, about their challenges, but also about their insecurities and what they conceive to be partner relationships, but also what they interpret as the conditions that they find themselves from within the family, within the institutions of learning, and how all of that, has somewhat disempowered, particularly young women. And so, through these conversations, we're able to deal with also, some of the stereotypes that are reinforced by the kind of society that we are, a very male-dominated type of society. And these are the things that we learn from churches, from our own communities, and these things are what comes out from here. And young men and women are able to correct, to further understand and clarify amongst themselves. So that's what we're seeing. But what we're also seeing is that it's not merely about talking and engagement. It's about the presence of professional assistance. It's also about we have here, for instance, also the National Student Financial Aid Scheme to try and sort out some of the issues and challenges that students may face. You never know to the extent within which student allowances and state intervention in terms of a package of bursaries to both TVET and university students have a long way in mitigating against gender-based violence. It means you're removing young men and women from a position of vulnerability. From them not to rely on sugar mamas and sugar daddies in abusive relationships, anywhere else. And that's why we think it's important that it's a package of intervention. It's also about partnerships. That's why we have the provincial government. We have also various national agencies who are tasked with the professional intervention around issues around gender-based violence. Just last week here, there was a case where a student was allegedly raped. It is not because we came here for that reason, but we're planning to come here in any way. But also it's not because we're here because it's Women's Month. We do these conversations continuously because we think that when students speak amongst themselves as peers, they tend to learn amongst each other and listen to each other more. And hopefully we will achieve zero gender-based violence and femicide in our universities and in our TVET colleges.
Thank you very much, Deputy Minister Desiree. That's the Deputy Minister of Higher Education, Science and Innovation, as well as the MEC for Health in the province, Poppy Ramathuba, mentioning some of the contributing factors towards GBV and how they hope to mitigate those challenges in the university sector. But for now, we're going to link up to our weather desk to get the latest update on the weather front.